All right, everyone. Thank you for taking the time, gifting us your time this afternoon for our annual Medicare webinar. I had the privilege of joining Karl again this year, Karl Steinlage with Steinlage Insurance Agency. Um, Karl is the co-owner and CEO of Steinlage Insurance Agency. He's married, a father of two. Um, got 2 degrees from SLU, probably longer ago than he wants to admit, but his undergraduate and his MBA from there. And so he's really an expert in this field, so we appreciate it. It's very nuanced, and each year, as all of you are aware, that probably the reason you're joining is there's usually some level of change that he can really help us walk through. The reason we've really enjoyed partnering with Steinlage through the years, there's a few reasons. One, their independence. We appreciate their independence. They can shop around to 50 or so different carriers. They're not, captive to one of those, and they can really find the one that best fits your family's needs. They're experts in their field. They've been doing this and analyzing the best coverage for many years that meet their clients' unique needs. We love that they're a small family business. This is a third generation business that Karl runs. And you can see his siblings with him there in that picture. They've been helping families with their insurance since 1950, I believe. And we really consider them more than insurance brokers. They're really advocates. They're willing to do these no-cost assessments with you. They're educators. They're willing to do webinars like this. They also do some of their own. So you can really be educated on all of this as much as you want. And then we really appreciate their partnership. They've done white glove service to our clients for many years, for as long as I've been around. So that would be, if you do not know who I am, my name is James Blake. I'm one of the advisors at Brand. If I haven't had the privilege of meeting you in person, I hope to soon. And I will hand over the presentation over to Karl. Thanks, Karl.
Yeah, you bet. Thanks for having me. And this is too many years to count now we've done this. So as I get older, I've quickly learned what a lot of clients have told me is, it goes by fast. And I have to start adding additional years on how long ago I think certain things were. So it's happening to me whether I want to admit it or not. But I am not quite ready for Medicare, but I have thousands of clients that are. My parents, my grandparents are on Medicare, my aunts and uncles. So we've helped them, along with many clients, just kind of figure out our healthcare system. So services that our agency can assist you on. We'll be focusing primarily on Medicare, but really you can reach out to us for assistance on life events, marriage, death, divorce, work stoppage, retirement. We never want to assume that COBRA is the best deal, or how do we navigate coverage, what we call bridging the gap, getting from 61 to 65. And so those are all services that we can provide assistance on, or situations that we can provide guidance on. If you're already on Medicare and maybe you haven't looked at this in a number of years, as you'll quickly learn, chaos is kind of the name of the game here with our healthcare system, with some of the laws that the federal government have enacted. And so plans that have been very rock solid, competitive, good deals for many years are now starting to shift and change and drop medications and increase premiums. And so maybe this is the year, if you're already on Medicare and you've been happy with your plan, it's worth having a set of eyeballs. So we're happy to review current Medicare arrangements. If you purchased your Medicare coverage from our agency in previous years, you do get the offer of a free evaluation on your prescription coverage. And so we send out a survey each year asking for updated prescriptions to reevaluate which drug plan you're on. And then if you have high income and we can show a life event, there's something called IRMA, which we'll discuss, and there's an appeal process that we can assist with. So let's jump right in. Really, we're going to focus most of the presentation on Medicare. If you have any questions, feel free to reach them out with the Q&A. And James, if there are questions, feel free to interrupt me. I find a lot of times that question is relevant to the slide that we're on, and so we can kind of just pause and take a break and talk about that. So
we'll do. And then if there's any remaining questions, we'll try to address them at the end. Like I said, we're going to try to be efficient with the time that you've given to us, but likely that Karl will kind of present for the next 45 minutes or so, and then try to get you all out of here by the top of the hour.
Great. So what is Medicare? All right, let's jump right in. And Medicare is health insurance offered through the federal government that we get really one of two ways. One is we're going to age into Medicare, which is a polite way of saying turning 65. So anybody with a birth year of 1960 becomes eligible for Medicare this year, or 1961 becomes eligible for Medicare in 2026. And so there's a period of time that we call your initial enrollment period that opens up 3 months before your birthday month. And this is often met with a mass influx of marketing materials, supplemental plans, Advantage companies, United Healthcare, Blue Cross. People are often surprised and shocked. Why am I getting mass marketed to 3 to 6 months or maybe even a year before my 65th birthday? And that's because the assumption is that you are retired and you are going to move into the Medicare program, which is sometimes a forced decision, but also comes with a buying decision on prescription coverage and a few other parts. And so Medicare, quite simply, is just health insurance offered through the federal government, just like you have health insurance offered through your employer. And so Medicare has two base components. We call this original Medicare or traditional Medicare, and these are offered through the federal government. And when Medicare was created in the 60s, it was very normal for people to retire well in advance of 65, activate their Social Security benefit at 62, and just naturally move right into full Medicare. So the marketing that you receive if you're approaching your 65th birthday often has this kind of assumptive tone of like, yeah, you're already on Medicare because you're retired. You need to go pick out supplemental insurance and prescription coverage to avoid penalties. But the reality is that now, as that average age of retirement has shifted further and further, full retirement age for Social Security has shifted to 67. We see many people are still working at 65. They carry the health insurance for themselves, for their family, for their kids, or vice versa. Maybe I am turning 65, but I am a +1 on my spouse's insurance. So where a lot of the confusion and the assistance that we can help you is to navigate, what do I need to do here? Do I need to do anything? Do I need to drop off of my group insurance? I'm on COBRA. I'm on a subsidized benefit through the Affordable Care Act. So everybody's situation into age 65 is a little bit different. And so the concern that a lot of people have is maybe an older brother or a know-it-all neighbor or a meaning well friend tells you, oh, you've got to get into Medicare because there's penalties. And so one of the big concerns that I hear from people getting into this for the first time is this fear of messing it up. I don't want to penalize myself long term. And so we'll break that down. So this slide and this part of the conversation is really geared towards people who are aging into Medicare in the next 12 to 24 months. If you're already on Medicare, you've already made that decision. You've added Part B, and we'll talk about some of the changes in the Medicare program later on. But if I am turning 65, I have what I would call kind of 3 true outcomes. And each one of these is right or wrong based off of your unique situation. So the number one concern that we hear is not being penalized. And the reality is that if you have employer-sponsored coverage through a large employer, which is over 20 lives, you can remain on that employer plan or remain on your spouse's large employer as a +1 and do absolutely nothing here. You don't have to raise your hand. You don't have to get into the free part of Medicare. So as long as you have an employer plan, and that's going to continue, you do not have to do anything at all. And there are no penalties. We would delay your Medicare A, which is the free part of Medicare, and your Part B, which is a portion you have to pay for, until you no longer have that active employer-sponsored plan. So sometimes the advice that we give clients is because your employer plan is as good or better than Medicare, and it's cheaper, your group plan is what everybody wants, more coverage for the least amount of money. So our advice in that situation would be to do nothing especially if your employer plan has a health savings account attached to it. So if you have an HSA, which is a side account that you are putting money into, or your employer is putting money into, you can continue to contribute into an HSA past age 65 if you delay all parts of Medicare. So if a client comes to me and they work for Bayer Company or Energize, a large company, and they have a very low cost HSA compatible plan, and maybe they're carrying that coverage for their spouse or kids, we would dissect this and say, you don't need to do anything. You don't need Part A, which covers hospitalization. You don't need Part B, which covers medical. And all of this external noise, supplemental, United Healthcare, Blue Cross, all that marketing material, you need it eventually, just not right now, because your employer plan is a better deal than what Medicare provides you. So door number one, we're looking at HSA compatibility. If you can fund an HSA and you are funding an HSA, then our advice is to typically do nothing so you can contribute to that HSA at 65, 66. Your HSA contribution needs to stop when you sign up for Medicare Part A or when you elect Social Security benefits. So if you are going to stay on an employer plan until 70, or maybe you have a much younger spouse that is going to carry you, we need to be sensitive to when you start drawing Social Security, you will be enrolled in a Part A. And there is a look back of 6 months. And so where HSAs become a little cumbersome is if you fund your HSA from 65 to 66 to 67, and then you're going to retire at 67, we needed to be sensitive to when you sign up for Part A, that effective date will back up 6 months and will interfere with your HSA contributions. So there are so many little nuances on this. This would be something I would invite you to set up a call with us so we can kind of walk through your specific situation. But very often our advice for somebody turning 65 is to tell them to do nothing because their group plan is HSA compatible. If your employer plan is not HSA compatible, you have what we call like a traditional plan or a PPO style plan where I walk into my doctor and I pay a copay at the window. Then our advice might shift to say, hey, let's go ahead and sign you up for the free part of Medicare. There's still no penalties. Even if you have a traditional plan and you delay Part A and Part B, that's totally fine. There's no penalties because your employer plan, through your full-time employment or your spouse with over 20 employees, that maintains primary coverage, just like it covered you when you were 62, 63, 64. So in that situation, what we would advise you, because there's no HSA, is let's go ahead and get your foot in the door. Let's sign you up for Part A of Medicare. It would be secondary to your employer plan. So sometimes a large claim through your group insurance might be subsidized by having Part A if you have a hospitalization. So an example would be if you had a $5,000 deductible on your group insurance and your first claim in the year was a hospital stay. If you had Medicare Part A has a small deductible that goes up every year, but this deductible might subsidize everything else, or this benefit, the Part A benefit, would subsidize your $5,000 employer-sponsored deductible. So having Part A might actually save you about $3,400 in that scenario. Instead of I owe the $5,000, I would run this through my group insurance first, then Medicare, and Medicare might pick up $3,400 approximately of that $5,000 deductible, and I would only owe the Part A deductible. So there can be a little bit of monetary or financial savings with Part A, but the important thing to know is that it's free. It has no monthly premium, and it doesn't disrupt your employer-sponsored plan. So sometimes our advice is to take Part A only if you have a traditional policy, but same thing, there's no penalty because you're carrying group insurance. And then the last one is to move all the way through Medicare, to drop your COBRA option at $1,000 a month, or if you are on subsidized or unsubsidized marketplace, the Affordable Care Act, Obamacare, then there are penalties if you do not move through door number 3, because individual coverage COBRA, whether it's subsidized or not by your employer, or retiree healthcare. I've had 2 calls today earlier where people work for the federal government, and they were kind of thinking, hey, the government allows me to keep my employer plan forever. I'm turning 65. What should I do? In that situation, they are not on active employer coverage. They are on retiree healthcare. The rules shift, and now we have to be sensitive to penalties. And so they ended up dropping or modifying their employer plan, their retiree plan, maybe making that their supplement, but they needed to sign up for Part A and Part B of Medicare. The other wiggle room here, or tricky thing, is if you work for a small company, you're self-employed, you work for a firm with less than 20 full-time employees, then typically your employer plan will say, hey, Medicare will be your primary insurance. And so that group insurance becomes a little bit of an awkward secondary policy. But if it's less than 20 lives, that's typically the trigger to have your group plan kind of step aside and say you actually need to move to Medicare. So this is an important decision because it really sets up the rest of your Medicare experience. And I meet people every year that enroll into Part A thinking they had to do that to avoid a penalty, which is not the case, and they forego multiple years of HSA contribution or employer dollars if their employer subsidizes their HSA account. And then every year I meet people that jumped into Part A and Part B and still carried their employer coverage thinking that they had to do that to avoid a penalty. So as much as we harp on this and the media and the marketing blitz that you receive, there are still people that fall through the cracks. And I would encourage you in a 5 or 10 minute conversation with our agency, we can make sure that you walk through the correct door to avoid surprises, to avoid having to pay more, and to avoid any type of penalties or coordination of benefit problems. If you have multiple insurances, sometimes your employer will get interference or the provider might accidentally bill Medicare, even though you're on a large group plan because you bought Part B, and then claims get messed up. So if we go through door number 1 or door number 2 or 3, then we are going to do that by logging into your SSA.gov account. So the way that you sign up for Medicare A only or Medicare A and B is creating an SSA.gov account and logging in and going through the motions. SSA.gov has had a little bit of an identity crisis in the last 5 or 6 years. We have seen the login credentials change for this site every year for the last 4 or 5 years. It used to be password protected. Now it's tied to an email. Now they've added multi-step authentication. Now people getting into it have to take selfie pictures and upload driver's license photos to validate their identity. And so one of the things I would encourage everybody listening to this webinar is to make sure that you can log into SSA.gov. Even if you do nothing, or we advise you through one of these two, we catch probably about 10 or 20% of people have had friction getting into this site. Maybe Brand or James has asked you to log into SSA.gov to pull an accurate Social Security statement so we can see what that monthly benefit is. And you weren't able to do that because you got locked out of the account. That might not be an issue at the moment, but sometimes people get thrown in curveballs, right? Their health changes. And so that idea of working until I'm 70 all of a sudden is not reality because my spouse had a stroke and now I'm trying to get them enrolled into Medicare while they're incapacitated. I can't get into their site. How do I take a picture of this person to verify their identity if they're not in a position to be able to do that? And so we want to get that possible headache out of the way when you're not stressed in a stressful situation because of a health event or an abrupt ending to your job or just in general, because sometimes moving into Medicare can kind of frustrate you because there's a lot of moving parts. So moral of the story here is if you are not able to log into SSA.gov or have not tried to get into that site in the last year or so, I would encourage you to just make sure you can. And then for our I guess, lucky folks that maybe have been drawing Social Security since 62 and been retired for a while, you will automatically be enrolled into both Medicare A and B if you are drawing a monthly Social Security check. And that card gets mailed to you in between all of the marketing materials about 4 months before your birthday. If you sign up for Medicare A only or Medicare A and B, say today because you're turning 65 in January or December, we find that this card gets mailed out about 30 days after you actually sign up. And it looks a lot like the advertisements you get on all this extra stuff. So be a little more sensitive to the mail 30 to 45 days after you sign up so we don't accidentally throw away that Medicare card. Or if you're drawing Social Security, know that it actually comes out around 4 months before your 65th birthday. So any questions on this, please reach out. If you have a specific situation, we encourage you to you're not wasting our time. We don't cost anything. We'll make sure that you are set up properly to walk through the correct door out of the gate. And that really does make your Medicare experience much more simple and efficient versus trying to do this or guess or, take the advice of a well-meaning friend.
Karl, the good news is we don't have any questions. The bad news is we had one more participant when we started, so we've already lost one.
Okay. So if we sign up for Medicare Part B, then there's a monthly premium that's associated with that. As of today, we do not know what the 2026 Medicare Part B premium is, but 2025 is $185 a month. So everybody that signs up for Medicare pays this standard $185. Next year, what I've read is that the Part B premium is likely to increase about 11%. So we're hearing this $211 premium as kind of the likely premium for 26. So we will know that probably around Thanksgiving. But Medicare is Medicare, right? If I live in Texas, I live in Missouri, I live in Florida, I enroll into the federal Medicare program the same way through SSA.gov or automatically if I'm drawing Social Security. And then I pay $185 for Medicare Part B. But then there's this fun acronym called IRMA, Income Related Monthly Adjusted Amount. So what happens is Medicare means tests your Part B premium. And the way that they do that is they apply a 2-year look back on your income. So if I am a Medicare recipient and I am a single tax filer or married filing jointly, then this first row is the number to be sensitive to. If my income from 2023 was less than $106,000, then I pay no additional surcharges. So I would just be paying Medicare $185. If you draw Medicare Part B and you are not drawing a monthly Social Security benefit, then the Medicare premium gets billed to you quarterly. Once you start drawing Social Security, then it flip-flops and comes out of your Social Security check before that check is deposited for the rest of your life. So if I am drawing Social Security, if I enroll into Medicare, then my premium is means tested based off of which bracket my income was from 2 years ago. So if I am aging into Medicare in December of this year, the price I pay for December of 2025 is $185 plus what my income was in 2023. And so let's say my income was $300,000 and I was a single tax filer in 23, I would be paying Medicare $670 per month. And if my income in 2024 dropped to say $180,000, then Medicare would update the bracket positively or negatively automatically January 1st without me doing anything. So in that situation, I would drop from bracket 4 to bracket 3, and I would have a reduction in my Medicare premium of about $130 a month. So this IRMA assessment will follow you for the rest of your life, and it is per person. So if I'm married filing jointly, let's say all the income is in my name because I'm a high income earner and my spouse is retired, it doesn't matter. The government will assess this fee equally for both of us. Now you get a little more wiggle room on the income, but it is a per person expense and there's an appeal process. So very often we'll meet somebody, at 65, and this is the make or break often when, advising someone, should I be moving to Medicare? I think of the school districts here locally in St. Louis. A lot of the school districts do not subsidize any of the spouse's benefits. So if I'm a +1 on a school district plan and I turn 65, but my wife is, 58, and she's going to work for a number of years, if our income is $200,000 or $300,000, I can't wait to get to Medicare, right? Even though you might fit in door number 1 or 2 is, hey, you've got a big group plan, a school district. We identify that your group plan is quite a bit more expensive than Medicare. Or vice versa. If I work for a hospital system, oftentimes hospital systems have pretty good benefits, and they help out with some of their spouse. But if my income is low enough where there's no surcharge and it's $400 a month to be on my insurance, I might move to Medicare here. But if our income is really high, I might decide that Medicare does not make sense because of this extra surcharge. So oftentimes your household income is the main determining factor as to whether our advice is to stay on an employer plan or to maybe proactively drop off of that employer plan and move to Medicare. If you've had a life event in the last 2 years, which work stoppage and work reduction is by far the number one life event, then you can appeal IRMA. And this is something that we can assist with, where let's say I retired at the end of 2024. And so I got into Medicare January 1st of 2025. The price for Medicare was $185. And then it looked back at my 2023 income, which was $1 million. I sold my business. So if I don't do anything, Medicare will assess me the highest fee for 25 because my 2023 income was really high. Then in 2026, they would look back and let's say I took one payment in 23, another payment in 24. So my income was really high in 2024. I would be paying this extra fee. And if I had a spouse on Medicare, she would as well, for 2 full years until 2027 looked back at my 2025 income, which let's say dropped significantly and was 200,000. So if you don't do anything, eventually you'll get that relief. But in that situation, we would recommend filing an appeal and having the government kind of speed that process up. And right in 2025, don't use my 23, don't use my 24 income, use my anticipated 2025 household income. And that's where we work really well with brand is to quarterback, hey, James, is this client able to appeal, and maybe there's wiggle room and they're, thinking, or you're talking to your advisor about Roth conversions or just, my income's going to be between 180 and 220,000. Well, just a little bit of foresight, we can keep you under a threshold, which allows you to remove that extra fee all the way right out of the gate rather than having to wait 2 years. The appeal is very much set up. If you guess at your income and you guess wrong, the government will square up at a later date. So if I come in and I, give a good faith estimate that my income is going to be under 212, but then I realize it's not, even if I don't do anything in 2027, when we look back at 25, which was the year I asked for forgiveness, they would go put me in the appropriate bracket and charge me the extra, no interest, no penalties. But the opposite is not true. If I don't appeal and I find out in hindsight that my income did drop, the government does not true up and give that money back. So we kind of use the accurate but aggressive approach here is to say, when in doubt, send in the appeal. So all of that is the foundation of Medicare, right? Medicare is once I'm fully in Medicare with Part A paying nothing and Part B paying, charging me $185 plus in IRMA assessment, that covers on average 80% of my hospitalization fees and my medical fees. So what I have found is that Medicare is the most inclusive, open-ended version of healthcare that exists. It has no networks. You're free to see any provider in the country that takes Medicare. There's like 98% of all providers in the country. There are no pre-authorization requirements at the moment for different services. So I don't need referrals to see specialists. I don't need to get a pre-authorization to get an MRI or a CT scan, which is very refreshing. Sometimes people will come to us and say, my group plan has great, premiums, but wow, it's really restrictive. And the doctor wants me to be on this drug or have me do this service, but my insurance will not allow me to do that. Getting to Medicare often can alleviate that frustration. So sometimes we see people move to Medicare not to save money, but to get better access to care. But the catch is that Medicare only pays 80%. So if we think of big picture ticket items, if I had a $100,000 cancer procedure, I owe 20% of the remainder, and there is no maximum out of pocket. So that kind of necessitates this additional purchase or decision, which is what all these marketing pieces are, on what do you do to cover the 20%. So we label that a homework assignment. If I'm on Medicare, I have to make a decision on how I cover the 20%, which kind of builds out this decision tree. Supplement versus Medicare Advantage. What do I do for prescriptions? So red, white, and blue Medicare does not cover blood pressure medicine, breathing medicine, stuff we pick up from Walgreens or get shipped to us through Express Scripts. So I have to add what's called Part D. And then there's also no dental or routine vision. Medicare will pay for cataracts and glaucoma and eye disease, but it will not pay for an annual eye exam and a pair of glasses. And so that makes up kind of the package. To do the job properly, you really need to enroll in a Medicare A and B once we identify that that is necessary, and then pick a path, supplement versus Medicare Advantage. And this is where a lot of the confusion comes in because you get so many choices, right? There's about 40 versions of Medicare Advantage that the average person can buy depending on the county they live in. And then another 30 or 50 flavors of supplement and prescription coverage. So you can have 10 people all on United Healthcare, and they're all saying, what's true and good and bad about their coverage, but they are on totally different versions of United Healthcare through the Medicare program. So if we kind of break this down, there is no wrong or right answer on this. We have about 70% of our clients on the supplemental path. But 10 years ago, that was probably 90%. So we've noticed the market kind of shifting to Medicare Advantage, but we are very agnostic with respect to, like, our agency receives a commission that is equal on either side of this. So we are not incentivized to try to nudge you one way or the other. And I share that with clients because it's all about education. You need to feel comfortable with the decision you make and the why and the premium behind it. But if we break down this path, this is our more expensive but more comprehensive setup. So clients will go down this path if they've kind of opted for the better coverage through their employer, if they place an emphasis on the freedom to go to any doctor at any time without any network restrictions. And it's important to note that the rules on Medicare say you get one chance to buy a supplement the very first time you move all the way into Medicare. So another concern people have is when I turn 65, I was told I get one chance to buy a supplement. Well, if I don't move all the way into Medicare, did I miss that window to go buy the supplement? And the answer is no. That window stays closed until you decide to open it by adding Part B. So if you do nothing or sign up for Part A only at 65, and then you come back to us at 68 to add Part B, that is when this decision tree becomes relevant. All of the marketing information you've received from 65 to 68 really was just wasted paper. But the marketing machine didn't know that you were going to work till you were 70. That's why you get this swell of advertisement every year. But rest assured, if you delay your Part B and then you flip on your Part B 1/1/26, that is when your window to buy this supplemental plan opens, and you get one shot to go the higher end option without answering health questions. So the way that supplemental plans work is you buy a standardized policy. So probably 95% of the enrollments that are out there right now across the country, across all different health plans, is through Plan G, like girl. So if you buy a Plan G Medicare supplement from Blue Cross and Blue Shield, here in the Metro St. Louis area, the going rate for that Plan G is about $175 a month. If you're in Texas, it's about $140. If you're in New York, it's about $300. So it will fluctuate based off of where you live, but you pay that premium in addition to your Medicare fee. And now that supplement wraps around and pays the 20%. So what people love about this setup is I can go anywhere I want because the supplement doesn't have a network. There's no restrictions on access to care. And then Medicare plus the supplement pay 100% of your bill. There's no copays. So you buy the supplement and then you add a separate standalone drug plan. The other choice when we're on Medicare is to enroll into a Medicare Advantage plan. Where this works a little bit differently is I still have to enroll into Part B and pay that Part B premium, but then I allow the federal government to subsidize a version of Medicare Advantage that I select. So there is money that goes from the federal government to this version of zero premium Medicare Advantage insurance. In the St. Louis market, it is very United Healthcare, Essence, and Aetna. Those are kind of the big three. And so if someone says, oh, I'm on United Healthcare and I don't pay a monthly premium, what they're telling you is that they opted into a Medicare Advantage plan. So what happens is you put that red, white, and blue Medicare card away. You still have Medicare. You can always go back to original Medicare and try to buy a supplement later on in life. But for the time being, you agree to get all of your care through the private company. So the good and the bad on Medicare Advantage, the good is that you don't have this extra $200 or $300 a month premium that you have to pay. All you pay is the Medicare fee, but the trade-off is that you agree to kind of follow the rules of the plan. So it's a lot like group insurance from, say, 30 years ago. Most of the Advantage plans in our market or that are out there are $0 premiums, zero deductible. They do have a network. Some plans require referrals, some don't. But you pay as you go that 20% up to the maximum out of pocket. So if I'm on a Medicare Advantage plan and I get sick, I show my United Healthcare card. I pay $10 or $20 to my primary, $50 to my specialist. If I have a 6-day stay in the hospital, it might cost me $3,000. But now I've hit my maximum and I am free or home free for the rest of the year. If I have that same claim with the supplement, I would have no network, so I could go anywhere I wanted, and I would have zero out of pocket because Medicare pays 80%, and this supplemental plan that I'm purchasing at an additional premium covers the 20%. And Medicare Advantage bundles prescription coverage, dental, vision, hearing, and some ancillary things if you've heard about like free gym memberships and over-the-counter perks. As we'll talk about here in a second, you know, the funding into these programs is changing quite a bit. So we kind of had a little bit of a nice ride here from about 2018 through 2025, where Medicare was throwing extra dollars at all these plans through COVID, and these plans were giving away free lift tickets and golf club reimbursement and flex cards. Well, now the government is kind of reevaluating how much money they're paying Medicare Advantage. And so we're seeing this market kind of shrink. But if I'm turning 65 or I'm retiring and I'm getting into Part B, this is what I would label your $1 million decision. And so our guidance is to kind of take your doctors, your prescriptions, your income, so we make sure we frame the Medicare costs correctly and help you kind of identify which path makes the most sense. That is the most important decision that you're going to make on your new to Medicare journey, is to pick a path. And then we kind of dissect, is Blue Cross the best deal? Is Aetna? Is Humana? You know, your spouse may have different medication needs, so they may be on a separate prescription plan than what you have. And there is no right or wrong answer. This is very much a tailored approach to your specific situation and you know, desire and willingness to pay and travel schedule, etc. So now we have this window. If I'm already on Medicare, I've made this decision a year, 2, 3, 5 ago. I have a choice or a window called the annual enrollment period, which starts here shortly, to review my coverage and say, you know what, my Advantage plan dropped a doctor out of my network. My prescription plan went from $5 a month to $90 a month, and I don't take any medications at all. This is your window to be able to switch paths, right? If I started on a supplement and now I want to change because I am still really healthy and my premiums have gone up, I can always move to a Medicare Advantage plan without answering any health questions. And we can do that during this end of the year window. Or if I'm on a Medicare Advantage plan and I'm just feeling a little uncomfortable about having to get referrals, or maybe I, couldn't see a doctor I wanted to see, then I might decide to kind of jump out and try to buy a Medicare supplement and a drug plan, but you have to answer health questions to buy that supplemental policy. So one of the big changes for this annual enrollment period is that we are seeing some pressure finally catch up with this market. And the pressure is that Medicare's drug coverage used to have something called a donut hole. And this is true on both sides. So from 2006 up until 2025, every Medicare drug plan out there had a donut hole. The government passed a law 2 years ago called the Inflation Reduction Act. And the Inflation Reduction Act changed the prescription drug market. This year, there is a maximum out of pocket of $2,000. The most I would have to spend if I'm on these high dollar biological drugs, or we now see everybody or a lot of people taking arrhythmia medicines like Eliquis or Xarelto, or these GLP-1 medications like Ozempic. Ozempic is $1,000 a month through a Medicare drug plan. So this law change that now limits my exposure to $2,000, if I'm on that drug, I love that because I will hit that cap in about 5 months, 6 months, and then I don't have to pay anything for my medicine for the rest of the year. But what that cap did is it shifted the cost from the consumer to the insurance company. So now insurers are having to pay a lot more on a per person basis for prescriptions, which about 80% of people do not hit that $2,000 threshold. So they are feeling the brunt of this, where costs are increasing. My Medicare Part D plan is going from $10 to $75 a month. Or my Medicare Advantage plan had a $0 copay for medications, and now it's jumping to $10 or $20. So we have that pressure, and then we have the federal government auditing Medicare Advantage, and this is all in the media and kind of being learned about and kind of fumbled through in real time. So the government pays these private insurance companies a lot of money, anywhere between probably $10,000 and $30,000 per person per year. If I sell you a Medicare Advantage plan, the government still charges you the Part B premium, but they subsidize these carriers very richly behind the scenes, which is how they're able to offer dental and vision and cover their marketing budget without charging you any additional premium. Well, when COVID hit, the government just threw a lot more money into this industry. Now we're kind of reassessing if that was the right thing to do. So the pressure is that these Medicare Advantage, and to a certain extent prescription drug plans as well, they're getting less reimbursement from the government. And so they're coming back and cutting a lot of those benefits that people have kind of been trained that get better. Dental's probably the number one plan or number one ancillary benefit. And so anybody that's on a Medicare Advantage plan, there's a very good chance that your plan will not have dental next year, when 3 years ago it had $4,000 of dental. Or maybe your maximum out of pocket. We're seeing a lot of PPO plans in the greater St. Louis and like greater urban areas. They're going from a $4,000 maximum out of pocket to $9,000 because the government is cutting the funding to these plans, and the utilization, especially on the prescription side, is a lot higher. So clients that have been on Medicare for a number of years and maybe just let everything ride because of this Inflation Reduction Act, it's really creating chaos in this market. There are estimates that about 3 to 4 million people will be losing their coverage. And in certain parts of the country, like the St. Louis market, missed a lot of this. We didn't get many what we call SARS, service area reductions. But in Minnesota, about, 200,000 people are losing their plan. So the number one things I think people listening to this, and we're already on Medicare, I try to pull out kind of the main highlights. One is that on most Medicare Advantage HMO plans, we didn't need referrals for the longest time, but now referrals are coming back. So if you are on a Medicare Advantage HMO plan, there's a good chance that you do need referrals in 2026 when you did not need referrals in 25. Blue Cross and Blue Shield is terminating their Medicare Part D plan across the country, and there are 400,000 members that have a Blue Cross Part D plan. So that is right here. If I'm on original Medicare, I go to the doctor, I show my Medicare and my Blue Cross supplement or my AARP supplement. This part is not being affected, but my standalone prescription plan that CVS has had for many years, so I don't even show my card. If I'm on a Blue Cross Part D plan, I am being dropped at the end of the year for the first time in 16 years. So that's a concern because you have a lot of older clients, or maybe people listening are kind of stepping in and helping their parents out. One way that I can help identify what they have and tell you if it's part of one of these plans affected is to send me a copy of the front of their ID cards. Hey, mom, hey, dad, what cards would you show your doctor and your pharmacy? If you went to a brand new doctor and a brand new pharmacy, what cards would you show? Great, let me take a picture of those cards and send it to Karl, and we can quickly tell you where they're at in this map, and then tell you if their plans are affected by some of these changes. And so that is a significant opportunity and disruption to have 400,000 people lose their prescription coverage. And Anthem, Blue Cross and Blue Shield is huge in the Midwest. And then in Medicare Advantage, the big one is United Healthcare. United Healthcare is terminating about 600,000 PPO members. Now, a lot of that is kind of pocketed in like the Atlanta market, out in like some certain parts of Texas. So it is very regional and kind of county specific, but people that have been on a United Healthcare PPO Advantage plan for many years and just thought, I have never looked at this, they're now going to be dropped and quickly learn in January that they don't have prescription coverage. That when they show that good old United Healthcare card that they've had for a long time, it is not active. And so they luckily have a little extended window. You can actually, if you lose your coverage, you have through February 28th to be able to get into a plan, but you might go a month or two without coverage, which is, risky and very expensive if something bad happens or you have expensive medications. So we've just got a lot of change happening this year because of the Inflation Reduction Act, and then some of the things that are hitting employer plans too, where we just have higher utilization because everybody is rushing back to the doctor post-COVID. So a couple last little comments, and then I can open this up to Q&A. Another thing that we are monitoring is that when the Inflation Reduction Act changed prescription coverage inside of Medicare, right? Earlier I said there used to be a donut hole. Well, now that there's a $2,000 cap, what we are finding is that some employer plans that maybe we met with you 2 years ago and said, you are on a great HSA compatible plan. So my advice in 2023 was to do nothing because your plan was credible and it allowed you to delay, where now what we are seeing is that some of these plans, as the Medicare coverage for prescriptions is getting better because it now has a maximum of $2,000 instead of a donut hole, we are seeing some employers come back to you and tell you that your prescription coverage is not credible. It's not considered as good as Medicare Part D. And so what that can do is that can cause what we call the late enrollment penalty. That is not a penalty for your Part B as in boy, but rather it is a prescription drug penalty. So this is going to slowly but surely affect people that are on these HSA compatible plans. And it was, I think, an unintended consequence of the Inflation Reduction Act. So what is very frustrating for everybody, myself included, is that the government has not provided clear, concise application of this. This was a letter that a client that owns their own company received, and the HR firm that they use had no idea about this, but they're the ones that sent this letter out. So it's challenging, especially if you're doing this yourself, or even to provide guidance on what feels like a moving target. So it just goes back to, if you're turning 65, in a very organized, efficient 30-minute conversation, we can tell you or highlight, hey, your plan, because it's an HSA, is one that kind of fits in this maybe no longer credible status. It might be something that we ask your employer, pointedly, like, is my plan credible prescription coverage for Medicare Part D? Yes or no? And then using that information, it might kind of shift what your decision is to avoid any headaches when you move into Medicare later on in life. So kind of what to take away here. For the first time, I remember when I first started helping people with this, people that were born in 1942 were aging into Medicare, which was 2007. And it's just that's very impactful for me to think, wow, now it's 1961. But for the first time in 15 plus years, we are seeing what I would almost label a regression in the Medicare programs. The Medicare Advantage plans are cutting ancillary benefits. They're dropping certain hospital systems, right? You're hearing Mercy and Blue Cross and Blue Shield, John Hopkins and United Healthcare. It's for the first time we're seeing Medicare Advantage, just take a step backwards. And that doesn't mean that it's a bad spot to be, because many Medicare Advantage plans have awesome benefits, no deductibles, a maximum out of pocket of $3,000. But if you've been on Medicare and you're on one of those older plans that might be hit harder, there might be a better option. No extra premium, but lower copays and more dental and more extra benefits, because the plans kind of shuffle the deck to their advantage, increasing the costs on these older plans, knowing that older people are less likely to go look at this, and then introducing better versions of the same plan for the new consumer. And then underneath Part D, because of this Inflation Reduction Act, we are seeing plans non-renew. We are seeing premiums go from $10 to $80, from $25 to $160, along with shrinking the list of medications. So it's not pretty, quite frankly, if we have been on Medicare and we're renewing into another plan. But it's also, this is what has happened in the employer market. So we're all a little bit used to employer plans raising deductibles each year. So this would be the year to not just set it and forget it, and to have that little ounce of prevention. And if you are new to Medicare, we recommend reaching out maybe a little bit sooner than what normally we would say, about 3 to 4 months. But let's call it maybe 4 to 6 months in advance of your 65th birthday. And that way we have plenty of time to ask HR some of these questions and make sure that we put you in the right position to have success, whether that's right away or to say, hey, you don't need Medicare yet, but then we'll follow up with you at the appropriate time. And then the last thing I want to mention is the law passed in July, the One Big Beautiful Bill. A lot of that legislation misses Medicare. Medicare was really affected by the Inflation Reduction Act, which we are now in what we've kind of labeled, 2025 was the earthquake, 2026 is going to be the aftershock, which is expected to be as significant as the earthquake. And so the One Big Beautiful Bill really unfortunately kind of erodes the Affordable Care Act. So if anybody listening has, a split household where I am going to be on Medicare next year, but my spouse will not be on Medicare, what does he or she need to do? We can help with that as well. And the OBA law hits on a few things. Bronze plans are now HSA compatible. So this is awesome for the advisors, where we now have HSA options to be able to limit or reduce income. And then the main thing that we do not have clarity on yet is whether these enhanced tax credits are going to sunset at the end of this year, or are they going to be extended? So this has to do with if my income is low enough then I can get assistance buying a policy to bridge this gap to age 65. And when COVID hit, the government gave people a lot more money and you could make a lot more income and still qualify for subsidies. But that is set to run out at the end of this year. And that is a huge political debate right now that we just do not have clarity whether it's going to be extended forever for 1 year or just rolled back to the way this was before COVID. Final thought, if you are on Obamacare in Medicare, or excuse me, in the St. Louis market, we are seeing a lot of plans leave the under 65 market. So Aetna made an announcement over the summer that they are leaving all marketplace exchanges in the 17 states that they operate. So if you are or know anybody in St. Louis that really needs access to Barnes Jewish and Washington University, they were on an Aetna marketplace plan because that was the only product that would allow access to Barnes. Well, Aetna is leaving at the end of the year. And so those people need to make a choice or need to make a decision. At the moment, we do not have any clarity at all about who is going to step up and be the replacement. But that is something that we can provide guidance on as well. So I appreciate the time and attention. I know I went a little bit longer. Usually that's the case, but I've got a few extra minutes for any questions. And certainly feel free to reach out for guidance on your specific situation.
Yeah, I would just emphasize reaching out to either our team or directly to Karl. There weren't any questions in the Q&A, so I'll take that as a compliment. You should take that as a compliment, Karl, that you were very thorough with your explanation. But yeah, I mean, the thing there is there was a lot of nuance and seems like significant change each year. So feel free, please. We encourage you to reach out with any questions that you have after this. And thank you for your time, for everyone spending the afternoon with us.